Welcome to the CATC exam tutorial. The purpose of the CATC exam is to evaluate the knowledge and skills required to be a competent counselor in an alcohol and other drug or substance use disorder treatment setting, significantly based upon the competencies identified within the U.S. Department of Health and Human Services Addiction Counselor Competencies, also known as CATCP1. The exam development was subjected to a scientific validation process, a psychometric evaluation, in order to make sure the most important parts of the job are adequately represented and tested in the examination, and that the knowledge and skills of the candidates for certification as an AOD-SUD counselor are uniformly measured and tested. This tutorial is a tool designed to reinforce the information you learned in a formal counselor education program, highlighting important components of that education. It is not intended to take the place of a high-quality education program, but will present information and suggestions that should help you pass the CATC exam. This tutorial will cover the information contained within two textbooks, the Addiction Professional and Intervention, Treatment, and Recovery. The Addiction Professional Manual for Counselor Competency was developed and published in 2014 by Binding Institute, with contributing authors representing practitioners, administrators, and educators from throughout the United States, and includes important components of CATCP1, as well as the Clinical Supervisor, which is a training manual for clinical supervisor competency, and the MAT Counselor, which is a training manual that relates to the specialized skills and knowledge required in counseling within a medication-assisted treatment program. Intervention, Treatment, and Recovery, a practical guide to the CATCP1 addiction counseling competencies, was designed to help students understand and apply the CATCP1 addiction counselor competencies. It was developed by Dr. Lori Phelps, Executive Director of CATC, and this textbook provides an overview of each competency as well as exercises, case studies, assessment, instruments, and additional resources. In preparing for the CATC exam, we recommend that you watch this tutorial, highlight the areas pointed out within the Addiction Professional and Intervention, Treatment, and Recovery textbooks, write down the suggestions that we make during this tutorial, and then go back and study your notes and those highlighted areas within the books. The tutorial will go through the material rather quickly, so use this format to stop and replay the video as often as you want. The reason most often cited for failing this type of exam by experienced practitioners is that they did not study the material because they assumed that they had already been in the field for a number of years and were already familiar with the information. You may have already learned most or all of the information that is contained in the books and that will be asked on the exam, but don't assume that your past knowledge by itself will guarantee your passing this exam. The exam contains 100 multiple-choice questions. There will be 4 possible answers for each question, but only one answer will be the best answer. Here are some time-tested tips for taking these types of exams. Take care of your physical needs the day of the examination. Sleep well the night before and arrive early so that you have time to relax a few minutes before being called to the test. Expect items to be interspersed according to difficulty level and domain represented. On the exam, items do not become progressively easier or more difficult. All of the assessment items are not clustered together, followed by professional responsibility items, etc. Read each item carefully and completely before answering. The answer is in the question, so try to answer before looking at the choices. Read through all of the answer choices. There may be more than one answer that appears close, but there is only one best answer. The other choices, which are called distractors, are there to pull your attention away from the best answer. You can make it a true-false test by eliminating the distractors. In other words, eliminate the 2 worst answers and then select the best of the 2 remaining better answers. Do not spend several minutes on one item. Move along and come back to the items that require more thought if you need to. Choose the best answer of those provided. Another correct answer may exist, but it may not be one of the choices. This does not mean it is a trick question. Make educated guesses if needed. Even if you are unsure of the best answer, there are usually some answer choices that can be eliminated. If you have heard the advice that when in doubt, choose C, this does not apply to professionally developed exams and therefore does not apply in this situation. Each item should be answered since there is no penalty for guessing. And remember that the exam items reflect the current knowledge as described in the alcohol and other drug counseling literature, including the books that you are studying. The correct answer to some items may not resemble your opinion or how things are actually done where you work. This tutorial and the 2 textbooks cover the CATC1 Transdisciplinary Foundations and the 8 practice dimensions of addiction counselor competency. In addition, because it is required by California law, this tutorial and the textbooks cover communicable diseases, working with special populations, and the prevention of sexual harassment. We will start with the addiction professional, which tends to focus on the transdisciplinary foundations of CATC1 and includes information relating to communicable diseases, working with special populations, and the prevention of sexual harassment. We will then go through intervention, treatment, and recovery, which tends to focus on the CATC1 practice dimensions. You'll notice some overlap of the information presented within the 2 books and the 2 sections of this tutorial. We have done this on purpose because students have been taught this material by instructors who have included the information coming from different perspectives. For example, co-occurring disorders is addressed within both the application to practice section of the transdisciplinary foundations as well as within the clinical evaluation section of the practice dimensions. Do not be confused by this overlap when it happens, and just use it as an opportunity to reinforce the information that you have learned. So grab a highlighter and a pen and let's get started. We will start with the Addiction Professional Chapter 1, which covers history and an overview. There is important historical information in this chapter that you should know as a professional counselor, and the important parts to know are everything that is in bold font, especially within the chronology of chemical use and abuse. For example, know about the Washingtonians, know about the 18th Amendment, about Narcotics Anonymous, and know about the Hughes Act. Again, know everything that is in bold font in this chapter. And then near the end of the chapter, under a few facts, which starts with, according to the U.S. Assistant Secretary for Health, know everything in that paragraph. In Chapter 2, know about the various community efforts at addressing problems of addiction, the Minnesota model, the recovery homes, hospitals, managed care, and outpatient non-residential treatment. Know what the components of those models are and know how to distinguish between them. And also know about Marty Mann and the National Council on Alcoholism, also known as NCA. In Chapter 3, know who makes up the members of the nuclear family and the family of origin. Know the difference between those. Know the relationship between community and organization as it relates to the family system. Know about the family system and its subsystems. And know about the family community boundaries, such as rigid, disengaged, diffused family members. Know what those characteristics are and be able to distinguish between them. Know about the increase in the number of step families. Know about family homeostasis and know what that means. Also be able to distinguish between the various roles like placater, blamer, family hero, scapegoat, lost child, and a mascot. Know what all of the characteristics are of each one of those various roles and be able to distinguish between each of them. So, for example, if the exam asks you to identify which family member is the one who acts out and abuses alcohol and drugs to take focus off of dependent and unsolvable family problems, you should know that person will be the scapegoat. If the exam asks you to identify which family member is usually the oldest child and a high achiever, you should know that the person will be the family hero. If the exam asks you to identify which family member is usually the one who provides fun and humor and distracts the family from problems, That one is usually the mascot. And if the exam asks who the enabler might be, your answer could be the employer who pays a salary, a drinking partner, or a spouse or parents of underage drinkers who control the purse strings. In Chapter 4, know which Latin word personality comes from, know the differences and be able to distinguish between id, ego, and superego, and know the information contained in this chapter about the Myers-Briggs test. Also know about Erik Erikson's 8 stages of psychosocial development, and know the general differences exhibited by well-adjusted versus addictive persons in dealing with fears and anxiety. In Chapter 5, know the definition of the terms provided: ethnic, nationality, race, minority, bigotry, prejudice, and bias, and be able to distinguish between each one of those terms. Know the meaning of each one of those terms, and also know and be able to distinguish between ethnic and cultural stumbling blocks in building blocks. Know the factors that increase a woman's risk for alcohol problems, and also know which people are generally included in ethnic groupings in alcohol research. Know the general prevalence of drinking among different ethnic groups, and also know the following: the ethnic and cultural considerations in a therapeutic group setting enhance the group process and promotes treatment goals. Understand that minorities may be underrepresented in addiction therapy and why. Understand that therapist and patient awareness of their own prejudices can minimize resistance and promote treatment goals. And understand that counselors should be educated about the norms and lifestyles of minority group members in order to discern which behaviors are symptomatic of personal psychopathology and which are attributable to cultural influences.